So here we are at our little evidence-based practice. Beginning part should be review from Introduction to Athletic Training and from Techniques 1. We're going to go into a little more in depth in this section about how we critique evidence, because I think that's the part that we haven't done as much. You know, when we start talking about asking questions and things like that, you've had lots of practice with that. Now it's really the time in your development that you should be able to really start thinking about not only what does the evidence say, but is that evidence good? Okay, and that's going to be a big part of your project in this class. So when we're thinking about modalities and evidence-based practice, it's so important because we often select modalities out of habit rather than having a clear plan. Okay, remember even back to those 3 questions. There are people who don't ever ask themselves those 3 questions, and that's really sad. Okay, we really want to see evidence-based practice having a larger role in what we pick. So the goal of EBP is really to have efficient, effective treatment, minimizing the patient's desire or undesirable effects. So whatever they are complaining about, whatever restrictions that they have, and then making effective use of the clinician's time. So it's not just about what the evidence says, it's about how it relates to our patient and our treatment plan and our facility and our experience and so on. The tricky part compared to our type of evidence that we were looking for evaluation, the tricky part with an intervention evidence search is that it's really hard to evaluate the evidence of an effective treatment because there's so many factors that go into it, right? The type of patient, their exact condition, what other things they had going on, what outcome did this study measure? Is that the outcome I'm looked at based on my patient goals? All that becomes really hard. And because of so much individuality, even in a really good study or series of studies, we can see a lot of contradiction and we can see a lot of statements like it's inconclusive, okay? Different tissues, the depth of those tissues, the age of the patient, where in the healing process that patient was there even an actual condition, or was this done on healthy tissue and then measured for some sort of outcome, and then we just make assumptions about what would happen on injured tissue? The application protocols, when you guys start looking at parameters used in modality research, sometimes aren't even present. Sometimes the author does not even share what parameters were done, which is crazy because how are you supposed to know? But so those application protocols can vary significantly from what you would potentially do. Poorly designed studies, or a lot of times we take animal studies and automatically assume that there must be something to glean from that. And so inappropriate application of those animal studies can also be problematic. So when we're talking about evidence-based practice, there's kind of 2 definitions I really like to throw out to the students. One is this idea of the conscientious, explicit, and judicious use of the best current evidence. Okay? Inaccurate evidence may lead to inaccurate decisions. However, we have to also be able to judge what evidence is out there. And if we don't have the highest level of evidence, okay, what happens when we bump down and pay attention to this lesser level of evidence? Well, in our heads, we need to be able to judge that and take that into account when we make our planning, okay? Ideally, we want to use the best available evidence possible. Also, integrating individual clinical expertise with the best available external clinical evidence. So again, a lot of times people say they don't agree with evidence-based practice because it's too cookie cutter, right? We're just following what the research says. And that's not what evidence-based practice should be. It should take into account your clinical expertise, your interactions with this patient, the uniqueness of your patient, and come up with a plan based on what is out there, okay? And whatever level that could be. Evidence-based practice and patient-centered medicine, again, like I said, are not necessarily at odds with each other. So people who kind of want to give evidence-based practice a bad rap say, well, it doesn't talk about the patient at all. You're just worried about the numbers and what research says, and that's not true. The true goal should be using the evidence to reach the goals of your patient. And so again, keeping the patient centered is really important, that your focus is on the patient and their activity level or their disablement, okay? So find out what works for this patient. And I think a really important aspect of this is there's a reason we don't give you just an evidence-based practice class, right? We don't tell you just to take a stat class or take research and stats and that's all evidence-based practice is. It's incorporated into each and every one of our classes because it's not just a task. It's not just a skill you have to learn and get signed off on for your competencies and then it's back in the back of your head. It's never done in isolation. It's always done with evaluation, with treatment, with rehab, with thinking about patient care from a healthcare perspective. It's always done all together. Mm-hmm. So by now you should know it is a 5-step process, right? With the first step being asking the answerable questions, searching for evidence, so we'll go over a little bit of that. Critical appraisal of that evidence for its validity and relevance. That's going to be a big emphasis in this class. It is now about not just what you find, but is what you found relevant to your patient, relevant to your question, and good, solid research. Because then, and only then, can we really make a true decision. And again, keeping the patient values and your clinical expertise in mind. And then the 5th part, which tends to be forgotten, is evaluate your performance. Okay, so now that you completed this process, you made your decision. Was it the right decision? Did your patient respond well? What did you change? What went well for you? What searches and search strategies went well for you? How did you write your question? All that should be kind of a self-reflection.